Cefuroxime Sodium Vial is a medication used to treat a wide range of bacterial infections. It can also be used to prevent infection after certain surgeries. This medication falls into a category of drugs called cephalosporin antibiotics, which work by halting the growth of bacteria. It is important to take this medication as directed by your healthcare provider to ensure its effectiveness. The dosage and timing of administration may vary depending on the specific condition being treated, so it is important to follow the instructions provided by your doctor. Always consult with a healthcare professional before taking this medication to ensure it is the right option for you. When using Cefuroxime Sodium Vial, it is important to follow the dosage and administration instructions provided by your doctor. The medication is typically given by injection into a muscle or vein every 8 hours. The dosage will depend on your medical condition and how your body responds to the treatment. If you are administering this medication at home, it's essential to learn the proper preparation and usage instructions from your healthcare professional. Before using the product, visually inspect it for any particles or discoloration. If you notice either of these, do not use the liquid. Make sure to store and discard medical supplies safely. If you are using the frozen pre-mixed solution, you will need to thaw the bag at room temperature or in the refrigerator. If thawed in the refrigerator, let it sit at room temperature for at least 1 hour before using. Do not thaw by putting it in a water bath or microwaving it. After thawing, shake the bag well and check for leaks by squeezing it. If the bag leaks, discard the solution. Do not refreeze the solution after thawing. For optimal effectiveness, it's important to use this antibiotic at evenly spaced times. Try to use the medication at the same times every day to help you remember. It's crucial to continue using this medication for the full duration prescribed, even if your symptoms improve after a few days. Stopping the medication too early may result in the return of the infection. If your condition persists or worsens, be sure to inform your doctor. If you experience swelling, redness, or pain at the injection site, be sure to inform your doctor or pharmacist right away. It's important to note that your doctor has prescribed this medication because they believe that the benefits outweigh the potential risks of side effects. Many people who use this medication do not experience serious side effects. However, it's crucial to contact your doctor immediately if you notice any of the following serious side effects: easy bruising or bleeding, unusual tiredness, uncontrollable movements, changes in mental or mood, seizures, signs of kidney or liver problems, or a severe intestinal condition. In rare cases, this medication may cause a severe allergic reaction. If you notice any symptoms of a serious allergic reaction, seek medical help immediately. This is not a complete list of possible side effects, so be sure to contact your doctor or pharmacist if you notice any other effects not mentioned here. And remember, do not use anti-diarrhea or opioid products if you develop diarrhea, as they may make the symptoms worse. If you experience prolonged or repeated use of this medication, it may result in oral thrush or a new yeast infection. Contact your doctor if you notice any new symptoms related to these conditions. And as always, if you have any concerns or questions about the side effects of this medication, don't hesitate to reach out to your healthcare provider. Before using cefuroxime, make sure to inform your doctor or pharmacist if you have any allergies to this medication or other antibiotics. This is important because cefuroxime may contain inactive ingredients that could cause allergic reactions or other problems. It's best to talk to your pharmacist for more details. It's also important to inform your doctor or pharmacist about your medical history, especially if you have kidney disease or stomach/intestinal diseases such as colitis. If you are planning to have any live bacterial vaccines, like the typhoid vaccine, it's essential to let your healthcare professional know that you are using cefuroxime. This is because cefuroxime may cause these vaccines to not work well. Before undergoing any surgery, remember to inform your doctor or dentist about all the products you use, including prescription drugs, non-prescription drugs, and herbal products. If you are pregnant, it's crucial to inform your doctor before using this medication. Additionally, if you are breastfeeding, cefuroxime passes into breast milk in small amounts and is unlikely to harm a nursing infant, but it's still best to consult your doctor before breastfeeding. When taking Cefuroxime Sodium Vial, it's important to be aware of potential drug interactions that could affect how your medications work or increase your risk for serious side effects. It's important to keep a list of all the products you use, including prescription/non-prescription drugs and herbal products, and share it with your doctor and pharmacist. It's also crucial not to start, stop, or change the dosage of any medicines without your doctor's approval. Additionally, this medication may interfere with certain lab tests, such as certain urine glucose tests, which could potentially cause false test results. It's important to make sure that lab personnel and all your doctors are aware that you are using this drug. If someone takes too much cefuroxime sodium vial and experiences severe symptoms like fainting or difficulty breathing, they should call 911 immediately. Otherwise, they should contact their local poison control center for assistance. In the US, residents can call 1-800-222-1222, and in Canada, residents can call their provincial poison control center. Symptoms of an overdose may include seizures. It is important to seek help if you suspect an overdose. It is important not to share this medication with others. Your doctor may also require you to undergo lab or medical tests, such as a complete blood count and kidney function tests, while you are using this medication. Be sure to keep all medical and lab appointments. Be sure to take each dose of cefuroxime sodium vial as directed by your doctor. If you happen to miss a dose, consult with your healthcare provider for a new dosing schedule. Do not take a double dose to make up for the missed one. Be sure to consult the product instructions and your pharmacist for storage details, and always keep medications out of reach of children and pets. It's important not to flush medications down the toilet or pour them into a drain unless specifically instructed. Make sure to properly discard this product and it is expired or no longer needed. If you have any questions about how to dispose of it, consult your pharmacist or local waste disposal company. If you need more help, call your doctor for medical advice. In the US, you call FDA, 1-800-FDA-1088. In Canada, you may call Health Canada, 1-866-234-2345. Wishing you good health. Thanks for watching.